If you're recovering from an injury, your doctor may refer you to therapy. The question is, which one? Now, there are different kinds of therapy. The most common ones are physical therapy and occupational therapy. Now, how do you know who to go to? Hi, this is Reggie from Result Plus Physical Therapy. And in this video, we'll dive into physical therapy and occupational therapy. What are the differences? What are the similarities? And more importantly, who do you go to when you're recovering from a pain, an injury, or a weakness? Oh wow, this is so confusing. I don't really know what kind of therapy I should do. Now, before we get into everything, I want to give a disclaimer. I am not in no way, shape, or form, and in no means saying one profession is more superior than the other. I'm a physical therapist, my sister is an occupational therapist. And my goal is to give you some basic information that you'll need so you can decide what kind of therapy you should go to. And the points that I discussed here are from an orthopedic outpatient setting perspective. Now, let's jump right into it. What is physical therapy? Physical therapy is the treatment of an injury or a condition using physical methods such as exercises, modalities such as heat and ice, or manual therapy rather than surgery or drugs. As a physical therapist, we are movement experts. Movements such as walking, climbing stairs, or running. We also help patients with their daily activities. So physical therapy has a bigger scope because it encompasses the movements and the daily activities. Now, what is occupational therapy? Occupational therapy is a form of therapy for those recovering from mental and physical illness. It encourages rehabilitation through the performance of activities in your daily life, such as self-care, recreation, cognitive or emotional function, and fine finger motor skills such as feeding, dressing, and bathing. If you're finding this information helpful, please give us a thumbs up and subscribe to our channel. Now, what are the similarities? There are a lot of similarities between the two. Both of them are drug-free treatment. They both use exercises. They both use soft tissue or manual therapy. And also, they both use physical modalities like heat or ice. Now, physical therapy can treat the whole body. Now, occupational therapy, on the other hand, mostly focuses on activities of daily living. So mostly it involves the upper extremity. Physical therapy can treat your upper extremity, your lower extremity, and even your trunk. So it encompasses the whole body. That's why most of the doctors are more familiar with physical therapy rather than occupational therapy. Very common that you will hear people say physical therapy is lower extremity and occupational therapy is upper extremity. Although physical therapy can also treat upper extremity. Occupational therapy, though, can treat social, emotional, and sensory issues. The other typical generalization is physical therapy is gross motor, while occupational therapy is fine motor. Example there is the physical therapy can help you get to the bathroom, but the occupational therapy will help you be able to wash yourself or brush your teeth. So to summarize, when you have a problem with your lower extremity or your trunk, go to a physical therapist. If your problem is your upper extremity, you can go to an occupational therapist or a physical therapist, especially if you don't have any occupational therapists in your area, because physical therapy is more common. If your problem is sensory or cognitive, then go to an occupational therapist. Now, if your problem is both upper and lower extremity, go to an occupational therapist for your upper extremity problem, and then go to a physical therapist for your lower extremity problem. I hope that clears things up for you so that the next time you have a pain, injury, or weakness, you know what therapist to go to. And in the meantime, if you want to see more conditions that a physical therapist treats, check out this next video.